Hello, thank you for watching Just Upright. My name is Ginaline Ruder. I go by Jing, like Jingle Bells. I'm a physical therapist. I used to be a review lecturer for 8 years. I was a medical transcriptionist for 3 years, and then um, a physical therapist in clinical practice, mostly in skilled nursing facilities, and right now inpatient rehabilitation as well, and sometimes home health therapy. Okay, so I have like 17 years of physical therapist teaching and clinical experience. Okay, so what we're going to talk about right now is the problems of two stories houses, house or apartment. I have encountered so many patients in my clinical practice with multiple steps to go to access the front door. Some of them can range from just one step, 4 or 5 steps. And I have actually encountered a patient who needs to do 36 steps before she can access her apartment because the apartment did not have any elevator. Okay, so some people will have just 1, 2 steps outside, but they have stairs to navigate inside, and their room and bedroom are located on the second floor. Or some of them don't have second floor, but they have a basement, and they have to do their laundry or office work downstairs. So we're going to discuss different factors uh, that is of consideration when you are in therapy after you've been sick or after you broke your bone, and in relation to navigation of the stairs. Okay? So, most people have a dream house, and some of them are so big, some of them are just simple. So, if you are in the process of planning for your dream house, this is a good presentation for you because there are things that you want to consider in planning a dream house, especially if you wanna, some people say, die in that house, live in that house forever, and you don't want to move out. So listen to this presentation. So these are some of the examples that I have encountered. I have patients, again, who live in multi-story houses. Some of them have like, it range from one step to 36 steps, just to go to the front door. Some of them live on the hill, some of them live in an apartment with so many steps. So, and some of them have one step outside, but then they have steps or stairs inside going to the second floor or going to the basement. I even had one patient that, she was living in an apartment, and in order for her to access the second or third floor, she needed 36 steps. And it was an apartment with no elevator. And then, so that is a problem, especially when you fracture a bone or bones in one or two or both of your legs, and you cannot bear weight. It's very hard to navigate the stairs that way. And some patients that I encounter, they have two-story house, uh, but they may or may not have bedroom on the first floor, but most of them don't. All the bedrooms upstairs, and then the bathroom is upstairs, and they don't have any full bath on the first floor. So it's like really a necessity for them to go up and down the stairs. Okay, so those are the scenario that I have faced, with patients. So according to National Safety Council, every year there are 12,000 stairway accidental deaths every year. People are dying on navigating up and down the stairs, and that number includes people of all ages. So it's not just the older adults, across, it's across all age group. So what I have noticed, if I have a patient who in their daily life has to go up and down the stairs, their muscle strength is really stronger than the ones who live on the first floor. So that is, one of the advantages of going up and down the stairs, because you don't think about it, but it actually improves the strength of your muscles and your endurance. But I always tell my patient, if you have watched my presentation before, age 65 and above, that is, age alone poses a risk for falling. So if you top that with, you need to navigate the stairs, your increase for falling is a lot higher, especially if you have fallen before. A previous fall poses a high risk for another fall, So I always tell my patient and educate my patients that you have to weigh the pros and cons of going up and down the stairs. Is it really a necessity? What are the disadvantages of needing to go up and down the stairs? A higher risk for falling with more serious injuries such as head injury, concussion, multiple fractures. I had one patient, she lost her balance going down the stairs, and she hit her elbow on the wall on the landing and actually made a hole on that wall. And, needless to say, her elbow was really hurting when I saw her. So these are some of the the usual activities that can cause fall to happen on stairs that I have encountered with my patients. Um, Going up and down the entrance steps to carry the groceries, going up and down the stairs carrying laundry. I had one patient that I remember. She was carrying laundry upstairs, and it's in front of her, and she fell backwards. I forgot how many steps, but maybe 5, 6 steps. And when I saw her, she had multiple rib fractures. And there are so many other people that patients that I have interviewed who had the same thing happen to them. Okay, so just plain going up and down the steps poses a risk of falling, just like I've said before. Age alone, 65 and above, it carries the risk of increased fall risk on a level surface, but it doesn't say about the stairs. So stairs really increases the risk of falling, especially if your blood sugar, your blood pressure is not controlled, or all of a sudden went too high or too far low while you're navigating the stairs. Dizziness and vertigo, distraction. I have had a patient who fell because he was going down the stairs. The phone rang. It was in his pocket. So he reached for the phone and tried to answer it while he's going down the stairs. And then he fell. Okay, so distraction can also cause um, fall while you're navigating the stairs. So what happens when sickness set in? So, some patient will not have a clear picture that the stairs will be barrier. They would say, oh, I had no problem doing the stairs. I've been doing that for 40 years. But the problem is when the sickness set in, it depends, what kind of sickness you have, and how weak you are. The stairs can be a barrier for discharge, meaning you have to navigate the stairs first safely before you can actually safely go home. So it is one of the main considerations. burden of setting up the house to accommodate the need. So some patients who are really, for example, they have a non-weight bearing order for 6 or more weeks in one or both of their legs, and they don't have a room in the first floor nor a bathroom in the first floor. So, some family members will adjust the home situation in which they're going to put bed in the first floor. So that's one way of getting around it. But if you don't have a bathroom in the first floor, that is where the problem sets in. So just like I mentioned, I had a patient actually. She was a tennis player and she was in her maybe 70s or 80s, and her arms was so strong, and I don't know if she needed to go home, she wanted to go home, or the insurance uh kick in and she will not be covered. But all I can remember is that I had to train her to use her arms, and so she's sitting on the steps, on the step, and then she will use her good leg and her arms to push herself up and down, going up and then going down the stairs. So, navigating the stairs in seated position, So if your arms are strong, it will be possible for you to do that. But some of the patients, especially the sedentary before, or highly overweight, very weak, um, they are not able to do that. So those are the problems that you would encounter if you do not have a room set up in the first floor and a bathroom. Okay, so what are the practical tips? So we talk about the barriers for discharge and all the problems that you may, but not all, maybe some of the problems that you may encounter in a house, a multi-story house. Um, so ask yourself, is it worth breaking your bone? For example, your bedroom is upstairs, and some patients, I want to really sleep in my bedroom. Okay, we respect that, but they have to come into like realization that if it is not safe for them to go up and down the stairs anymore, is it a problem? Is it worth it to break their bone in doing so? I always counsel some very highly independent older adult who still have been doing their laundry in the basement. They're using one hand for the rail, the other hand for the basket, and I would ask them, is it worth it? Laundry and breaking the bone. So um, we'll discuss some other recommendation later. So slip resistant thread. So it's like a duct tape, that it has adhesive on one side. You can cut it any length you want, and it's almost like a sandpaper on the top. And you put it, if your stairs is made up of wood, this will work. If it is carpeted, it will not work. So for wood or concrete steps, this is a good way so that your foot will not, or your shoe will not slide at the edge of each step. Rails on both sides are very ideal. Um, and if you really need to go upstairs, it's expensive, but it is safer to have a chairlift. That ones we see in the commercial, in which and then ideally you should have light switch at the bottom and top of the stairs. Well lit stairway is very, very important in order for you to see where you're going, not to trip over and fall as much as possible. If you are going to build a house, be sure to have at least one room downstairs and a full bath. So these are for, people who are building their dream home and they want to grow old and some people will say, I want to die in this house. So be sure that there's a room in the first floor and a full bath in the first floor, and ideally there should not be multiple steps outdoors in order to access the door. If there is, ideally there should be rails on that, and some people actually build ramps, if it is getting hard for them to access the entrance of the house. Okay, consider the ramps. Okay, so I guess that's it. Thank you for watching. These are the books that I have written. The practical tips for therapists prior to migrating or starting their US practice. I also have the PT Path for US, Path to US. So this is like a step-by-step guide for physical therapists on how to apply to be a licensed therapist here in the US. And then this one is just upright, practical tips to improve posture, balance, and decrease fall risk. So I am a strong advocate of fall prevention, and the reason why I wrote this book is because um, I felt so sad that I am able to educate my patient only after the fact that they have fallen, because most patients won't see you because they have a balance issue. Most people are actually living in denial that they're not gonna fall. And I'm telling you, and it's also written in my book, that none of my patients planned to fall. They did not like the fact that they have fallen. So if you want to be well informed of the practical ways how not to fall, you can read this book. This is an easy read book. I back it up with research studies, per exercise, or some of the things that I discuss there are based on research studies. It's not just my clinical experience. Okay, so please do not forget to subscribe and share this video if you find it informative and of use to you. So thank you for watching and stay blessed.